Catherine. I have a question for you.
Yes. What is it, Krista?
Nick and I are trying to answer question 13 in our case study. It asks us to identify 4 nursing interventions. Should we include the fact that we need to maintain the IV heparin?
That is a great point, Krista. Of course, you will need to monitor the INR PTT as per the heparin protocol. But I think for this question, try to look at the big picture. As a nurse, ask yourselves, what should I do now to get an overall picture of SKS health?
There seems to be a lot going on with this patient. Can we share with you the 4 interventions that we have picked out so far?
Yes, Nick. Let's all go to the back and we can work this out together. So, let's go through what you guys have done. What is your first intervention?
We thought that an ongoing assessment of the respiratory system was really important. This assessment can also include monitoring ABGs and the need for mechanical respiration.
Great thought, Nick. Inspecting, palpating and auscultating the interior and posterior thorax is a priority. Can you tell me why would the team focus their efforts here?
Well, it's always important to maintain and support the airway, even more so considering the pathology and physiology of a pulmonary embolism.
Yeah. Also, patient outcomes rely on accurate and effective assessments that considers lung function, work of breathing, oxygenation, ventilation and perfusion, resistance and flow.
Great. Remember that evaluating your treatment outcomes is important. It may lead to more respiratory interventions. Okay. What's your second intervention?
The second intervention would target the patient's pain. Because he has had surgeries, it may be good to complete an OPQR-STUV assessment.
Poor fellow. Lots going on here. How complex. A pain workup would certainly help to determine the need for medication, repositioning, rest, massage or psychosocial intervention.
Exactly. It is also a chance to ensure that the pain is managed and tailored to his needs. Great point on the need to reassess. It helps determine if treatments are working.
Great. So what is your third intervention?
Our third intervention is related to the patient's wounds. He has multiple fractures and needs to be checked up on. Looking for signs of bleeding, infection not to mention healing.
Right. He's been given a bunch of heparin and streptokinase too. That risk for bleeding is important to follow up on. Great thinking, Krista.
And the idea that bacteria may be introduced during the surgery or after is enough to monitor temperature, complete blood count and administer prophylactic antibiotics as per order.
This is so exciting. You guys are really grabbing a hold of the complexity here. What's your fourth intervention?
Well, there is just so much. We want to mention the CMS assessment, but we know he is going to need to have a conversation about his ADLs, his business, his anxiety and sadness. He won't be able to drive. How is he going to use a walker with 2 broken wrists? Who will do his groceries or let alone feed him? What do you suggest we work on?
These are grave questions for the interdisciplinary team, and the referral to services will most certainly be made to OT, PT and social work. I'm glad you're considering this. For this exercise, however, think about what you can do at the bedside.
We thought that completing a CMS assessment would be appropriate. Circulation, movement and sensation is important considering his recent and risk for DVTs.
Not to mention that a problem related to CMS may put him at a risk of delayed wound healing. He doesn't need a longer stay. He's been here for long enough.
You two have given this a lot of thought. I think if you present the facts that we've discussed, then you will have answered the question in great detail. Keep up the good work.